Welcome, everyone. I'm Dr. Teddy Potter, and I'm a clinical professor with the School of Nursing at the University of Minnesota. And I am delighted to welcome you to this regional session, the Midwest session. Today we're going to have several experts speak, and I can hardly wait for you to meet them. Next slide, please. And next, please. So all the states that are in this region are connected by water, either the Great Lakes or the Mississippi River. We are a water people. Next slide, please. And because of that, a lot of people think that the Midwest is the ideal place to move because we're climate resilient. They think of us as having this abundant fresh water, which we do, large lakes that oftentimes act as sort of a natural air conditioner, and we're located inland, far from the coast. But let us tell you a little bit about the truth of what climate change is doing in our area. Next slide, please. We have a lot of craziness happening. The jet stream goes right over the Midwest. So the fires that are burning in Canada, their forests, when their forests are on fire, our lungs are on fire. You can see this picture down the lower left. It shows the smoke carried right over Minnesota. Our air quality in the summertime has been up in the 200s, 300s, and at one point it was even 800 in northern Minnesota this summer. Our winters are actually warming, which is kind of crazy. And now we've entered the ice belt where there's a lot of motor vehicle accidents. People are slipping and falling on the ice. They're getting injured, head injuries, broken hips. And we had to rescue people who were out fishing on one of our northern lakes because the ice broke up prematurely. We're having vector changes. This is a picture of the limes or the deer tick bite in just my family alone. And then our farmers are really struggling because of changes in water patterns, increased droughts, heat episodes, crops are not growing. And because of that, farmers are at risk for suicide. So as much as we are a area that people think are climate resilient, it's not the land that makes us resilient. Next slide, please. It's the relationships. We are a tight group of people, and our relationships and partnerships are what make us resilient. So I invite you to listen to the wisdom of the people that will follow. It is my pleasure to introduce Dr. Sheetal Rao, who will guide the rest of the conversation.
Hi, everyone. I'm Sheetal Kedkar Rao. I'm an internal medicine physician on faculty at the University of Illinois, Chicago, and I'm also the co-founder and chief health and engagement officer of Nordson Green Earth Foundation, which is a member of the NAM Climate Communities Network. I'm very delighted today to introduce our speakers. We're going to start off with Helena Volzer, Senior Source Water Policy Manager with Alliance for the Great Lakes, and then Ian Hughes, Director of the Office of Environmental Sustainability at Rush University Medical Center, Katie Wickman, volunteer and former board member at Healthy Climate Wisconsin, Joe Bjorgard, Senior Climate and Health Manager at the Climate Advocacy Lab, and a board member with Health Professionals for a Healthy Climate. We also have with us Heidi Root, who's the Director and Associate Professor of the Climate Adaptation Partnership at the University of Minnesota. Today, we're going to hear about some innovative climate and health educational resources and training programs to accelerate the connection of health professionals, communities, and other stakeholders within and across regions in the United States. And with that, I will hand it off to Helena.
Thanks so much for having me. I'm here to talk about a recent report that the Alliance issued back in August called A Finite Resource, which really puts the spotlight on how finite our Great Lakes really are, managing the growing water needs of data centers, critical minerals mining, and agriculture. Next slide, please. As you can tell right away from the title, we focused in on kind of three sources or sectors, if you will, that are increasing the demand for water in our region. Data centers and other things like semiconductor chip manufacturing, quantum computing. We'll spend the most time talking about this, in fact, almost all of the time. But I do want to point out that critical minerals mining and agriculture are also mentioned within the report. And just to highlight what Teddy said about agriculture, the overlap overlapping needs for water between data centers and agriculture are something we may begin to see increased conflict over, particularly groundwater resources. Both data centers and agriculture need more water in the summer when it's hot, and so we may see potential for conflict there. Next slide. So this is just a map I like to start with to give folks an idea of where data centers are located throughout the Great Lakes region. They tend to cluster around these major metropolitan areas for access to things like energy transmission lines and high internet speeds. For reference, Illinois and Ohio, Illinois is 4, Ohio is 5 in the country in terms of the number of data centers. And you can very clearly see Data Center Alley there in Virginia is number 1 in the country. But the number doesn't tell us the whole story about the increasing demand for water. Next slide, please. So what's really driving the demand for that is hyperscale data centers. These are much larger facilities than we've seen in the past, and that demand's being driven by the needs of generative AI. Generative AI requires vast data processing capabilities, and these facilities can use between 1 and 5 million gallons of water per day if they're using evaporative cooling. To put that in perspective, 1 MGD over a year is the same as 12,000 Americans. The numbers I have here on what is a hyperscale facility, there is no hard and fast definition of that. And many of the facilities we're seeing now are much, much larger than this floor that I have here of 10,000 square feet, 5,000 servers, 20 megawatts of load. Next slide. So data centers can use a variety of different cooling methods. If you're interested in this, you can find more in our report. It's available on our website. Evaporative cooling has the most concern for us in terms of direct water use inside of a data center. This is where water is pushed through a membrane to bring down the temperature inside the server room, and it has the most consumptive use of water associated with it. Liquid immersion and direct-to-chip involve exposing equipment directly to water, and that has some water quality questions associated with it when that water is discharged. And then closed loop is where we're really seeing a transition now to more systems coming online with this type of cooling. And this has lower water and energy needs, but there's an indirect water use component associated with data centers because they are very large energy users, and we call that the water energy nexus. And that increased water use at power plants, when we're talking about fossil fuel or nuclear power, also has the potential to increase consumptive use of water. And then finally, with air cooling, that's just the use of large fans and is really insufficient to support the needs of AI. Next slide, please. So one of the main findings of our report is that we really don't know what the water use footprint is of an individual data center. There are no water use reporting requirements where large-scale water users are hooked into municipal supplies. And this is particularly relevant for data centers because over 97% of data center operators are using municipal supplies. And because there is no requirement to do so, less than a third of data centers are even tracking their water use. Again, I talked about the water energy nexus. That also requires water. And right now we can't calculate how much of that's being driven by data centers. And then finally, non-disclosure agreements, common in economic development, are really obscuring how much water and energy is proposed to be used at the outset of a project. Next slide, please. The Alliance got into this work because we have a long history of working on the Great Lakes Compact. It generally prohibits diversions of Great Lakes water out of the Great Lakes Basin, that is, transfers to a different watershed. There are some exceptions for that along the Great Lakes Basin line. But some of the other things it does are require states to manage their Great Lakes water use, to have conservation and efficiency goals and programs, and to establish common water use reporting protocols to a regional database so we can get a picture of water use throughout the region. And I pulled this phrase out of the compact because it's the message that our report tries to send, and I think relevant for all of us, is that these programs were never meant to be static. They're meant to adjust to new demands and the potential impacts of cumulative effects and climate. Next slide. So I want to briefly touch on why local solutions to this problem aren't enough, and our report really focuses on state-level solutions. There's really a threat to groundwater integrity here based on this convergence of demand from all sectors and all states that we mentioned. And our groundwater laws are somewhat inadequate to allow the states to limit groundwater use before there's been some kind of adverse resource impact. In addition to that, we already have existing groundwater conflicts in the Great Lakes region, portions of Southwest Michigan, the Central Sands region in Wisconsin, Little Rock Creek in Minnesota, and then just west of South Bend, Indiana, is the first case I've seen in the region where a EV battery plant and a data center are suspected to have impacted residents' wells. Also, with the water energy nexus we mentioned, it's very difficult for a local community that's facing a data center proposal to factor in the increased consumptive use of water at a power plant that might be located outside of their community. So really tough to factor that in. And then state-level economic development corporations might make siting decisions without local input at all. And what I'm increasingly seeing now is the use of local restrictions or temporary moratoria to kind of push the pause button on data center siting. And that might pit communities against one another that are better situated to enact those kinds of restrictions. And in addition to that, state legislatures might start to respond. And that's already started to happen. And I'll pick on Ohio, where I'm from, which has introduced some legislation that would severely limit not only local control, but state level control over data center regulation. It would require a compelling government interest and that the regulation be narrowly tailored to that interest. So setting a really high bar for the state and local governments to actually enact any kind of regulation. Next slide. So our report, for that reason, really focuses on solutions at the state level. What can the states be doing better to accommodate all of this demand? The first one is regional planning studies that evaluate where water is available and where it's not. And Ohio, Illinois, and Indiana are three states that have started work on this area. But these kinds of studies need to be incorporated into ongoing conservation programs versus one-time, one-off studies. And they should really evaluate ecosystem and environmental needs as part of that demand calculation. How much water for fish populations and how much to sustain groundwater flows. These need to be factored into the demand calculations. And then the whole point of doing these studies is so that the economic development corporations and local governments can turn to them when they're siting and deciding where to locate these projects. Transparency and accountability, both on the front end in terms of public disclosure requirements and ongoing water use reporting requirements, are really necessary. I've also pointed out community benefit agreements, which are something that can be used to alleviate that transparency and bring the community into the decision-making process and perhaps alleviate some of that pushback that people have seen against data centers. They could bring some kind of water resources benefit back to the community, be it in the form of a conservation or efficiency practice, committing to paying for water infrastructure. There's a lot of different ways those could be used. And then tax incentives and abatements. Every state in the Great Lakes region has enacted some kind of sales and use tax incentives to attract this industry. And while we generally think those could be pulled back on, there's also ways to connect them with water use. Michigan, for example, has said if you want to avail yourself of the tax credit, you must connect to where there's existing supplies to prevent the build out of water infrastructure just to service data centers. And then finally, conservation and efficiency standards that don't silo water and energy needs. Connecticut has a bill on this. But data centers don't have to use potable, finished drinking water. They can recirculate water. They could co-locate with wastewater treatment plants. And the non-potable water is something that Ohio and Illinois, which have established chapters of a water reuse association, are starting to explore. What are the regulations that would need to accommodate that? Next slide. And now finally, the most important slide for all of you, how you can get more involved and learn more about the Alliance. Our website, greatlakes.org, there's a report of the report I just talked about, our fact sheet, and a more in-depth length webinar specifically on the data center issue. We also have a volunteer ambassador program that you can engage with, and you can subscribe to our newsletter for alerts and updates on what we're doing at the state level. I also want to point out that the Alliance does a lot of other work outside of water quantity issues. We also work on agricultural pollution, plastics pollution, water infrastructure, water affordability, invasive species. And so you can find more about that on our website as well. Forthcoming, I'm working on a toolkit for communities to engage in state level advocacy. So that will be something that we'll put out through that newsletter to provide an update when it is available. And then finally, just staying in touch with me, and my email address is there on the slide for ways that you can be involved. It's really helpful to connect with professionals such as yourselves when we're engaging on policy and considering what are the health impacts of some of these policies. So thanks very much, and I'll turn it over to whoever's next.
Thank you so much, Helena. We're going to move over to Ian, who's going to tell us about some of the great work going on at Rush. Just a reminder for any listeners who have questions, please put them in the Q&A and we will get to them at the end.
Thanks, Sheetal. Thanks, Helena. My name is Ian Hughes. I'm the director of Rush University Medical Center's Office of Environmental Sustainability here in Chicago, Illinois. Next slide. I'm going to kind of talk through from a high level, some of the really great things that we're doing that are kind of, we like to call it multi-solving, co-collaborating, things along those lines, just ways that we're addressing a variety of different issues. And I'll start by kind of framing where Rush University Medical Center is. We're on the near west side of Chicago, as you can see in the picture on the right, within eyeshot of the beautiful skyline of downtown Chicago, just off 290. And we are situated in the Illinois Medical District and serve a majority of our patients come from the near west side of Chicago. Next slide. And I say that to help frame two things that our community health equity and engagement and anchor mission teams have been focusing on for decades. They've been looking at the life expectancy and wage gap that you see on the near west side of Chicago. So if you look at that image on the left-hand side, you see the loop over there with the 80 kind of called out. And that's where all of our train lines kind of converge downtown. Predominantly wealthy, affluent, white neighborhoods for the most part, and they have a life expectancy of 80 years. You take the Blue Line train 6 stops to the west into East Garfield Park, and that drops by 14. I think that number is actually recently updated to 20 years less life expectancy. Similarly, on the income side of things, you see a county-wide annual wage of around $59,000. City of Chicago is 52,000. You get out to West Garfield Park, and that's less than half, right? So these social and economic determinants of health are something that have a significant impact on people's ability to be healthy in the first place. And next slide. When we started our work here at the organization about 5 years ago, we were curious, we saw those maps and we're like, well, I wonder what the environmental burden looks like for these populations. And sure enough, it follows very similar patterns when you go from downtown Chicago. The map on the left shows environmental and pollution burden increasing in those lighter colors, from the lighter colors downtown to the west side. The little cell that's highlighted is Garfield Park. Pretty significantly. And similarly, there was a study done for Heat Shy where they looked at heat exposure across the city on one of the hottest days of the summer a few years ago, and monitored street level humidity and temperature data, and found a 20-degree difference from downtown on the lakefront. We get a nice cool breeze off the lake if you can afford to live out there, to the near west side and south sides being about 20 degrees hotter. So it's really important to look at this from a holistic perspective and kind of step out of our silos a little bit to have a more of a holistic picture of what's happening to human health. So next slide. So we'd like to call this multi-solving. We definitely didn't coin that term. That was Elizabeth Sowen. I've got a link down here in the bottom, and in all these slides, I do have links so you can click through. But this is essentially, taking multiple groups of people to collaborate on a variety of different problems that have all kinds of overlaps and intersections, kind of saving ourselves money and time, right? It's an iterative process. It takes a lot of learning and curiosity, but it is something that's actually helped us to tell a lot of stories in a more holistic manner that looks at all aspects that are potentially affecting human health, which is really exciting. And though we're not quite to the flower model in that lower right-hand corner there, of looking at all of these aspects of projects and of implications of doing work at Rush, it's definitely something that we strive to achieve. And something that we're getting better at the more we, again, step out of our silos. I love that Helena mentioned silos as well. Stepping out of those silos and kind of standing in the intersection together. Next slide. So our work, my team, the Office of Environmental Sustainability, we're like any other sustainability department focusing on measuring, managing, and minimizing our environmental footprint. We do so across these 5 pillars, and that is like the shortest summary I could possibly give of our work that is very wildly complex and kind of crazy. It is just 3 of us, right? We just have a small team of 3, and I know we're very lucky because I know there's other departments that are typically teams of 1. Next slide. But what we like to do and what we like to kind of make a joke of is we're a small but mighty team of 3 trying to be a team of 10,000, right? Because without the support of all 10,000 employees across our organization, there's no way we're going to make this work happen in the time span that we need to make it happen. So we've created a wide variety of multidisciplinary working groups. We've got top-down support from senior leadership. The working groups dig into a little bit more specific areas like greening the operating room or recycling, sustainable materials management, efficiency on the utilities side of things. But we find a lot of deep enthusiasm in and around the research and university space. Students and faculty in particular are very excited about sustainability. We have a ton of just individual sustainability champions across the boards that we're leaning on to help us, again, drive this work. Next slide. So a couple of really cool projects, and you can do next slide. The really exciting one on our food waste side of things, we've got kind of 2 main alleyways that we avoid food going to landfills. On the recoverable food side of things, we donate, thanks to our partnership with the University of Illinois Chicago. They have a student group that comes and picks up, they do a literal milk run of surplus food in our neighborhood. They pick up from us and then they drop it off over at the Franciscan Outreach, which is a shelter for the unhoused just west of our facility. That ends up being about 200 to 400 pounds of food per week, which is really exciting from a perspective right now, especially everything going on with SNAP benefits and things along those lines, but also keeping that food out of the landfill. Next slide. The other vein that we've got is collecting our unrecoverable food to send it off to Green Era campus via our woman and local owned business collective resource. There are a compost hauler. They take it down to Green Era campus, which is an anaerobic biodigester. They digest our organic material, turn it into renewable natural gas and nutrients. The solids that come off of that help grow food, right? So we're creating a nice circular economy with that. Next slide. And that actually saves us pretty significantly on a greenhouse gas emissions perspective, which from our team's perspective, that's fantastic. But looking at it from the broader community, social, and economic side of things, this has many, many wins across the boards. Next slide. Another one that's a great example of this is our partnership with Fillmore Linen Service. They are a newly opened laundry service that is on the near west side of Chicago in North Lawndale. We were one of the original folks, healthcare organizations to sign up. And instead of sending our laundry 80 miles round trip, we're now sending it 8 miles round trip, which has its own environmental implications, of course, from a greenhouse gas perspective. But the facility itself is brand new, state of the art, incredibly efficient from an energy and water perspective, which is fantastic across the boards. But also on the community and social side of things, this has been a historically disinvested neighborhood. And we've now helped to support the creation of 80 new jobs, paying great wages and benefits and all that really great stuff. So this is definitely an awesome opportunity to show kind of the strength of pulling together those anchor mission, community health, equity, and sustainability teams. Next slide. We've also supported community solar. We are doing some really great work with this. For those that aren't familiar, the state of Illinois has got some really great programs with community solar that actually, when you sign up as a subscriber on the commercial side or the residential side, you get a bill credit, right? So you're actually getting a financial win, which is really exciting. You're supporting that bigger transition to green energy. And what's really great about this is we're building a clean energy workforce, right? We're helping in the support of these community solar projects, build out job opportunities for these neighborhoods, and then provide new opportunities for residential subscriptions to help them save money on their utility bills. Next slide is just a high level of how far we've come with this work. We're almost at 50% under contract with renewable energy through community solar, which is really exciting for us. Again, that's over 20 solar projects in Northern Illinois that we're supporting. Next slide. Planetary Health Report Card is a great one. We love this. It's a great opportunity to engage students. They lead this assessment of our organization to say how well we're integrating planetary health into our education. And then they hold our staff and faculty to it, which is really, really exciting. I'm going to leave that at a really high level, but this has been an amazing opportunity for students to get engaged and participate in these programs. Next slide. I'd be remiss not to mention our great partnership with the Alliance for the Great Lakes. I was on the Young Professionals Council a long time ago. I'm a huge fan of this organization. So when I found out that we were doing some really great joint fundraising initiatives with the Alliance for Great Lakes to really start to better understand microplastics, not only in the Great Lakes, there's estimates that 22 million pounds of plastic end up in our Great Lakes every year, which is crazy. Lord only knows how many pounds or ounces are finding their way into our bodies. But we've got some really amazing folks internally who are doing some great research in this space to better understand the impacts on human health. And then on top of that, we're obviously incredibly aligned with their work around the increasing water and energy demands of these new data centers. Next slide. And I think this is my last one. Give a quick plug for the Illinois Clinicians for Climate Action. If there's an opportunity for anyone in the state of Illinois to join this, it's an amazing organization that just got started, doing some really great, exciting work. And if y'all would like to stay in touch, please feel free to reach out via LinkedIn. Thanks so much for the time.
Thank you so much, Ian. Now we're going to move on to Katie Wickman with talking about some of the work that's going on with Healthy Climate Wisconsin.
Thank you, Sheetal. Hi, everybody. Good afternoon. My name is Katie Wickman. I am a nurse by trade. I am a current healthcare sustainability professional and a former board member and current volunteer with Healthy Climate Wisconsin. We are, and we're born as a state-affiliated group of the National Medical Society Consortium on Climate and Health, and we've been able to build into a robust nonprofit organization that now includes 1,500 passionate members in the state of Wisconsin. Next slide, please. So our purpose is all about supporting the health of our fellow Wisconsinites through the voice and action of our health professional members. Specifically, as you can see on the slide here, our purpose is to enable Wisconsin's health professionals to support system transforming climate and health equity solutions within local communities, public and healthcare systems, and the government to ensure all Wisconsinites across every background and zip code can breathe clean air, drink safe water, enjoy our state's vibrant ecosystems, and thrive on a healthy planet for generations. That is a really good purpose statement, don't you think? One that so many of us can get behind. We can do next slide, please. And as I said, we started as a small group of health professionals that were passionate about climate and health. We're interested in bringing the work of the National Consortium on Climate and Health to Wisconsin. And we met around a table after a different conference back in 2019. And those early conversations of healthcare professionals, just like probably many of you on the call today, led to Wisconsin's first climate and health conference in late 2019. And it is a really good example, I think, of kind of that Margaret Mead quote, where, you know, you never want to doubt the ability of a small group of thoughtful, committed citizens. And that's really how we grew. And we grew through the pandemic. We became an official nonprofit in 2020. We hired part-time staff. We formed partnerships to take action together. And then in 2021, we launched work groups, a newsletter, because you have to have a newsletter, a speakers bureau, a regular conference cadence. And then since then, we've really been able to continue to build our capacity and reach. We currently have a vision for 7 working teams of healthcare folks to plug into based on their expertise and their interest. And we're excited about what the future holds as we continue to bring our voices to the table and to our communities. Next slide. So based on our annual strategy retreats, we currently have a vision for the world that we really want. And we have structured that into 7 teams in alignment with that vision. And as you can see, no matter what your passion around climate and health is, there is probably a place in Healthy Climate Wisconsin to use it. Most of the times, our teams are working on using the health professional voice, either in the education of their peers, their institutions, their communities, or with government officials to make the connection between climate and health, and then to advocate for healthy solutions. And so we do that across a number of different ways and on a number of different topics. And we know that they all can interconnect and intersect, whether that is water or transportation or climate smart healthcare or any of the other things on the slide. So, but in the next couple of slides, I'm going to zero in a bit on the climate smart healthcare team and its work to help our health systems in Wisconsin move toward climate smart healthcare delivery. So first, want to briefly mention the why here, and I'm sure most of you are familiar with all of this already, but you know, it's this knowledge that the U.S. health sector is responsible for not an insignificant amount of the pollution that harms human health, and that we as a healthcare sector contribute 8.5% of the U.S. emissions, also contribute 1/4 of global health sector emissions. That's a lot, right? And we can do better. And we want to help break that cycle of contributing to the health harms that then require treatment in our facilities, which then increases the healthcare demands, which then creates additional pollution. So breaking this cycle is part of what climate smart healthcare is. It includes both reducing healthcare's own contribution to the problem and preparing and adapting to the changes that are both here now and that will continue to come because of climate change. And I know a couple of our speakers have a lot more on adaptation in the minutes to come. Next slide, please. There are many benefits of climate smart healthcare. And of course, we've already touched on some of those very most important ones, like improving community health and the resilience of our healthcare system and the resiliency of our communities. But there are more. Many climate smart actions actually save money to healthcare organizations. We have some great examples of them here in Wisconsin with energy efficiency and other energy projects. One called out here on the slide is from Gunderson Health, now Amplify Health. But there are some cost savings that can come. We also know that health professionals care about this issue, right? The Commonwealth Fund reported in 2023 that Of the 1,000 US clinicians that they surveyed, nearly 80% of them believed that it was important for their organizations to address climate change and that doing so was in alignment with their organization's mission. That is a high percentage of healthcare professionals agreeing to that one statement. So climate healthcare, climate smart healthcare can improve employee satisfaction and engagement, which then can also attract and retain talent to your organization. It can also improve reputation among patients and visitors too. So that's a lot of reasons here to be excited about the work of climate smart healthcare. Next slide, please. So what does our climate smart healthcare team do? We do what most of our teams at Healthy Climate Wisconsin do. We connect with each other. We learn from one another. We try to educate our peers together. We work within our own health systems to move the needle, and we try to share our wins and advocate for further action. So just last month, we had a physician who was working on a presentation about the environmental impact of inhalers and wanted our team to review the content. That is perfect. That's a great opportunity and a great example of how bringing health professionals together to kind of provide their expertise can help each other move the needle and help instill the confidence in health professionals, instill that confidence of their own expertise and their own ability to make change in their corner of the world. So that's some of the work that we do. Next slide. We also love to share resources. We share the 6 success stories that we've heard from our Wisconsin health systems and hospitals. So those are available on our website. We also share tools and resources that we've created to support the journey to climate smart healthcare. In the chat, you're going to be seeing a couple of those things go out, as well as a link to our Climate Smart Healthcare Toolkit that we put together, which is full of tips and tricks to start the conversation in your organization. If you work for a healthcare organization, it includes conversation starters, a step-by-step guide for starting a team, ideas on projects, other success stories, some background information on health sector emissions, and then links to other publicly available resources for you. So encourage you to check that out when you have a chance. And then if you're looking to connect like right now or sooner rather than later, we actually have our annual conference coming up this weekend on Friday and Saturday in De Pere, Wisconsin, which is just south of Green Bay. We have both in-person and virtual options to attend. It is a great place to connect with other like-minded health professionals. If you're in person, it's a great place to eat some good food, learn from some experts, get some continuing education credits. I think there are 12 and a half available, and connect into the organization. If you are not available this weekend, but still want to get involved, just head over to our website. On the top menu option, there's a Get Involved button and then a Join Us button, and you can fill out that form. There are a lot of options to get involved, and if you just let us know how you'd want to connect, right? There are options to just get our newsletter, or there are options to get your roll up your sleeves and jump in. So we are not scary at all. Just fill out the form. We'll get in touch with you to hear more about you and your passion and your interest in the shared work. So delighted to be with you all today. Thanks so much for being here, and excited to hear from our next speaker.
Thank you, Katie. And next we'll move on to Jo Bjorgaard. She's going to talk about communicating climate and health.
Hi, everyone. I'm excited to be tuning in from St. Paul, Minnesota today. And we can go to the next slide, please. Great. So over the next several minutes, we're going to chat a little bit about how communication can bridge climate and health, why health framing makes climate change personal, relevant, and actionable, the role of trusted messengers in communication, and how collective narratives drive shared action. Next slide, please. Great. So let's dive in with 3 guiding C's for effective climate and health communication. And I want to quickly shout out my partner in developing this framework, Dr. Melissa Thone, who is a nurse and an emergency preparedness leader in Ramsey County, Minnesota. So this framework highlights 3 essential elements that make climate communication effective and inclusive and grounded in a shared value, which is health. Whether we're talking about air quality, housing, energy, or food systems, health is the thread that connects every sector and every region, something that everyone cares about. Health professionals serve as trusted messengers. Health framing gives messages relevance and emotional resonance. And health-centered storytelling makes climate impacts and solutions personal and actionable. And at the center of the three C's, or this trifecta, is collaboration. Leading with health creates common ground, opening doors for cross-sector and cross-regional partnerships. All right, next slide, please. This data from Eco-America shows that the majority of Americans, even across political lines, trust health professionals for information about climate change. So it highlights that health professionals are uniquely trusted messengers when it comes to communicating climate and health issues. And as a nurse, I'm proud to share that nurses have been rated the most trusted health professionals for the past 23 years in a row. Next slide, please. Great. So we asked a group of multidisciplinary attendees at the Midwestern Climate Resilience Conference why they think this is, why they think health professionals are consistently ranked among the most trusted messengers. And this is what we heard. We heard health professionals have long established relationships with their patients who are members of the community. Health professions are commonly known as professions rooted in ethics. They can see health impacts on a widespread population level before other professionals, and health professionals represent all generations. So if you have anything to add to that, feel free to drop it in the chat. And we'll talk about the first C. So our first C is credibility. We can go to the next slide, please. Health professionals are trusted messengers, and they're embedded in communities. So their words carry weight because they come from care and from lived experience. They make climate science relatable and link health impacts like asthma, heat stress, and mental health to real solutions like cleaner air, safer housing, and healthier communities. So when health professionals step into this role of trusted messenger, climate change becomes local, it becomes personal and actionable. Solutions matter in everyday life. Cleaner air means fewer hospital visits. Walkable communities mean healthier hearts, and renewable energy means less respiratory illness. So trusted messengers can help make these connections. And that's why they're at the top of the trifecta: building trust, shaping narratives, and driving along that collective action. Next slide, please. Great. And this survey is from George Mason University's Center for Climate Change Communication, and it shows something really important. Most Americans already connect climate change to human health. About 3 out of 4 people are thinking about how climate change affects health, and about 6 in 10 are actually worried about it. And that tells us something powerful. When we frame climate change as a health issue, something that affects our families, our patients, our kids, our communities, people pay attention. Health is personal, it is relatable, and it can move people forward to act in ways that abstract concepts like greenhouse gas emissions or sea level rise just can't do. Next slide. So as I just shared, climate change can feel distant or abstract, but framing it through health makes it local, personal, and urgent. Health connects climate to everyday lives of people, showing why it matters for their families, communities, and futures. The research on health framing shows that framing climate as a health issue increases engagement, even across political divides. Climate solutions often provide multiple benefits, something we often refer to as co-benefits. They improve health, advance equity, and protect the environment, which makes action feel meaningful on multiple levels. But it's really important to focus on health benefits, not just harms. So simply pointing out the risks of climate change doesn't strongly motivate behavior or policy support, but showing how solutions improve lives makes climate action tangible and moves people along to act. And finally, stories and lived experiences are very powerful tools when communicating about climate change. When people hear concrete examples, like a child avoiding asthma attacks because of cleaner air, or families benefiting from safer, more walkable neighborhoods, the issue becomes real and actionable. So as we frame climate through health, we're not just sharing facts, we're connecting climate to what people care about and motivating that meaningful action. That's why connection is the second element of our 3 Cs, or our trifecta. Next slide, please. Great. And the third C is collective action. Power is what turns individual efforts into collective impact. It's not held by one single person. It exists in relationships between movements and stakeholders, and of course, the people that they seek to influence. True power is durable and helps movements sustain progress, even as political contexts shift. But it doesn't just come from activity. It comes from strategically leveraging the right actions at the right time. So this is where collaboration across sectors and across regions becomes really crucial. And by working together across health, environment, business, and community organizations, and of course across the geographic boundaries, we expand influence, we pool our resources, and amplify our impact. Next slide, please. Great. And one of the most powerful ways to harness collective action is through our stories. They make abstract ideas tangible. They connect people to shared values and motivate action. Neuroscience shows that when hearing a vivid story, it actually activates the same brain regions as experiencing it ourselves. So our brains are wired to connect through stories. And this is why they stick. They translate power into real-world impact. They engage people emotionally and cognitively. So facts and data matter, but stories help people remember and connect. They link climate, health, and equity and show how climate change affects patients, communities, healthcare systems, all across the spectrum. Well-crafted stories bridge silos. They align clinicians and administrators and decision makers or policy makers, and they make the solutions tangible. So in short, storytelling turns abstract challenges into relatable, motivating action. Next slide, please. Great. So we've talked about 3 essential ingredients for communicating effectively about climate change, and those are credibility, connection, and collective action. So to see how this sort of plays out in practice, let's look at an example close to home. So this is an example that gained national attention, but it has very real health and equity implications. I'm not an economist or a climate scientist, but as a health professional, I immediately noticed the gaps in this narrative. So in 2019, the New York Times ran a feature calling Duluth, Minnesota, a kind of climate-proof city. It framed Duluth as a refuge, a place that might benefit as the climate warms. And that narrative spread very quickly and shaped how people think about the Midwest region, and especially Minnesota. But what's missing from this story is the human and health dimension. So since that article, Duluth has experienced a housing crisis, which is driven in part by new residents seeking a climate haven, like Teddy referenced at the very beginning of this webinar. And rising costs and limited availability have actually displaced long-term residents and put a lot of strain on local systems. And that directly affects health outcomes, from stress and instability to access to care, food, and community. And there's another layer here. It's the livelihoods tied to long, cold winters. Next slide, please. So to bring this back to the human experience, I want to share my own experience with a family in the Duluth area. My family has been going dog sledding in northern Minnesota for several years, always with the same family-owned outfitter. From our very first visit, I started talking with our guide and the owner about his observations of the environment and climate. And over time, those conversations deepened as we got to know each other. And he shared very emotionally that he had always imagined passing down this family-run dog sledding business to his children and future generations, as it had been passed down to him. But with shorter and warmer winters, that dream no longer feels possible to him. And he's encouraging his children now to learn other skills and prepare for a future without reliable, long, snowy seasons. And this story really made a light bulb go off for me. There are many families in northern Minnesota whose livelihoods depend on the long, cold winters, but yet their voices aren't represented in the Climate Proof Duluth narrative or the Climate Haven narrative. The loss of stability, identity, and income is more than economic. It directly affects health and well-being. So when we hear terms like climate refuge or climate haven or climate proof city, I think we need to pause and ask, who is this message serving? Who's being left out? And how can climate communications, whether about migration, adaptation, or resilience, be grounded in health, equity, and local lived realities? So that's why a collaborative, multidisciplinary approach is very essential, bringing together housing, economic, and health experts, along with local voices to shape narratives that aren't just hopeful, but honest and humane and actionable. And it's also worth noting that the ongoing narrative around Duluth being a climate-proof city has been acknowledged even by the original New York Times contributor who recognized gaps in how the story was communicated. So they're doing some repair work there, which is great. Next slide, please. So just to bring this all together and sum it up, when we lead with health, we connect to what matters most. And when we speak through story, we reach hearts as well as minds. And collaboration is so important. We turn shared values into shared victories and lasting impact. We have many fantastic organizations and champions that are really leading the way in this throughout the entire Midwest, including Healthy Climate Wisconsin and Health Professionals for Healthy Climate here in Minnesota, and of course, all of the speakers on this call today. Next slide, please. That's all I have for you. Please feel free to connect after this meeting. I'll pass it over to the next speaker.
Thank you, Joe. Next, we have Heidi Roop, and she's going to be talking about climate adaptation in Minnesota.
Hello, everyone. Great to be here, and hard to follow such a great set of heavy hitter speakers. So I'll do my best, and I know we're near time here, so I'll try to move through this quickly. I think as other speakers have indicated, it's hard to cover the breadth and depth of what we do in this. So really hoping to move through this so we can engage in conversation. My name is Dr. Heidi Roop. I am the director of the University of Minnesota's Climate Adaptation Partnership. I'll share a little bit about who we are as a program and some of the work that we've been doing that I think is both timely and sort of connected into this broader theme of how we're seeking to lead in addressing climate and health in Minnesota and the greater Midwest region. Next slide, please. So the Climate Adaptation Partnership is a nation-leading program with an approach to climate services and extension. So without going into all the details, we are a program that is jointly held between our College of Food, Agricultural, and Natural Resource Sciences at the University of Minnesota. We advance a range of research, including understanding how Minnesota's climate is changing, how the Midwest climate is changing, and what solutions work, when, where, and why. And so invest really deeply in advancing our understanding across economic, atmospheric, and social sciences. So we're sort of steeped in the research at the same time that we're equally steeped in and collaborating with our land grant extension mission. So our team sits between we have our research team and we have an extension team who are living and working and serving across the state, but they work together in close coordination as a team that's really bringing shoulder to shoulder the research and the engagement, education, technical assistance that is needing to happen as we seek to prepare for the impacts of a warming world that we have already set in motion as we work to respond to those that we are anticipating in the future. So we have brought together dedicated research and extension positions that are really focused on understanding these risks and figuring out how we manage them, and then moving that onto the landscape. And critically, really being on the landscape to understand what research and knowledge gaps need filling, and doing that in collaboration with our partners across the landscape. We have very intentionally brought in diverse sectoral expertise into all of these positions, spanning everything from agriculture and tribal food systems to public health. We have a nurse on our team, really thinking, I'll describe some of their work for today, to forestry, to science and climate and digital communication. So really thinking across the full spectrum, diverse sectoral and interdisciplinary expertise working in close collaboration with one another, all with the aim of delivering durable research-based education and technical assistance as we seek to manage our emerging climate risks. Next slide, please. Of course, it goes without saying, no matter where you are in the world and whatever geography you call home, that our risks in the context of weather and climate are shifting. These intersect with a range of the other risks that we navigate as communities and as a global society. And increasingly, the need is expanding for how we prepare for, how we respond to, and how we recover from the range of weather and climate-related disasters that we're experiencing. Here is a smattering of them to build on the climate refuge. Of course, Minnesota, as a climate scientist, I really despise that framing because everyone will experience climate change. We will all experience it differently. But part of how we will experience climate change is whether we're prepared or not, so that resilience piece and how equitable the distribution of those resilience investments are. And in Minnesota, we are navigating a range of impacts from recent events and also still recovering from some events that have occurred over the past several years, for which we are still seeking to make sure people have shelter, a safe place to call home, where kids can go to school and people can have all their care and other needs met. So while we like to think about these singular events and then move on, it, of course, for the communities that are feeling these impacts, rarely is it so fleeting, but rather life-changing and life-altering. Next slide, please. At the same time that we have growing risks and expanding needs, I think there are a few critical things. Of course, the landscape around us is shifting, and I'll talk about that in a bit. But there are a majority of Americans who are reporting having experienced extreme weather. So 72%, this is a study through the Pew Research Center at the end of 2024, 72% of Americans report that their local community has experienced one of at least 5 types of extreme weather in the past 12 months. So these were things like wildfire, sort of extreme weather, precipitation, and flooding events. So many of us report experiencing this. And importantly, over 70% of those who reported experiencing an extreme weather event are tying it to climate change, or in this case, they're also tying it to a negative impact on their lives. And this is where it really matters. I think this is really where the work of all the prior speakers and also the criticality of telling our story is talking less about these abstract phenomenons like derechos and other things, and really talking about what they mean for people. Folks reported negative impacts on their community, on their lifestyle, on their property, what they're paying for property, for construction costs, for their health and well-being, for their lives and livelihoods, their lives at work and school, and in some cases, the necessity to relocate. Next slide, please. So as we, as a research and extension program, sort of look at the realities and how we are in partnership of seeking to deploy solutions on the landscape and build that evidence base for how and when and where, we are advancing a few things. So we're trying to think sort of from the professional lens, how do we seek to be part of the solution? Some of the work that's part of our climate risk and resilience research portfolio includes better understanding and characterizing our future risk. What does that mean for how we build and design critical infrastructure like our stormwater and wastewater systems? How do we better prepare across our natural systems and our food systems? And what are the risks that we are anticipating in the near term? And then those multi-decadal changes that we think about when we're predominantly thinking about large infrastructure investments. I really don't want, as a taxpayer, to invest in roads that are going to fail in the next 3 to 5 years. I would rather invest in roads that last the multiple decades they're designed to withstand. But right now we understand that our design criteria often don't reflect the climate through which that infrastructure is going to have to, the climate it will have to withstand. So really critically thinking across that spectrum to what those risks are, better characterizing those, through to better thinking about how we can forecast what's going to happen in the near term. So we're working on enhancing our abilities to we call this water intelligence, really improve our forecast of floods, and think about how to leverage things like AI and machine learning in service with human forecasters to make sure that we can give communities as much notice as possible when disaster may be coming their way. We also are working really critically to think about how we fill gaps in early warning systems for vector-borne diseases and leverage our resources in climate and atmospheric science to think about systems that will help us partner with our health department, our emergency managers and others to make sure, and health professionals to make sure that we are casting an eye forward and making sure that we're protecting and providing information to communities to help protect their own health and well-being. We're also thinking about how we make sure we're understanding where we're spending our resources, of measuring and monitoring resilience achievements on the landscape, and making sure to the best of our abilities that communities aren't being left behind. At the same time, while we're trying to understand both the cost of adaptation and the cost of inaction. And this is work we're doing specifically in the state of Minnesota. And I know other states in the US have started to do this work or have completed economic analyses that really are intended to help motivate some of the business case for adaptation. Next slide, please. And just as a specific health-oriented example, so we do a lot of research, and I think that oftentimes folks are thinking, oh, well, science sits on a shelf. In this case, we are trying to do science that moves into decisions while really working hand in hand with community members to address some of the here and now. So while we cast an eye toward 2100, we also know it's really critical to cast an eye to today and figure out how we partner and improve the lives of folks in our state and those with whom we partner. So in this case, we're thinking a lot more about air quality in the state of Minnesota. And it turns out that in our largest cities, the highest estimated rates of death and disease related to air pollution are in communities that have the highest percentages of low-income residents, those with uninsured residents, residents of colors, and those living with a disability. Next slide. We also know that these communities, low-income people, our indigenous communities and people of color, have higher rates of heart and lung conditions. So these slides come from, or this information comes from our Minnesota Pollution Control Agency. So this is state-reported data. And zip codes with the largest percentage of residents of color have more than 5 times the rate of asthma emergency room visits related to air pollution than areas with more white residents. So underlying this is not just a climate challenge, right? This is exposure to pollutants that are, some of them are from industrial, most of them are from industrial drivers and non-climatic sources. However, we're also seeing that shift. Next slide. And in Minnesota, we are experiencing more and worse air quality as a direct consequence of wildfires, many of which are burning outside of the boundaries of the state of Minnesota. While we do have high wildfire risks as a state, the wildfire smoke that we're often breathing on, in some cases, our summers have had the worst air quality in the world. We've measured some of the worst air quality in the world over a few summers, a couple of days in the last few summers. And so there is more awareness around the challenges associated with not having clean air. And so we have wildfire smoke as another layer onto this challenge around clean air. Next slide, please. So as a program, of course, we're hearing a lot about this, and we are thinking, okay, well, what are some of the interventions and solutions? So there's this broader context and a growing field of folks really seeking to develop resilience hubs around communities. So resilience hubs are leveraging community organizations, trusted facilities, faith communities, and others to provide year-round, to continue to invest in these spaces as providing year-round services and community building activities, but ensuring that these spaces are healthy and safe, especially in moments of, say, extreme heat or disaster. So one thing that we've been thinking a lot about in Minnesota, a lot of the Resilience Hub work has been focused on a critical component, which is energy resilience. And we've been really thinking about energy resilience as one critical facet of what a comprehensive resilience hub looks like. So we've been talking about, well, what are the some of the healthcare services that could be offered during either chronic or these sort of acute events? How do we start to actually understand how to make these spaces themselves as resilient as possible, both in not just the energy, but also thinking about can they provide clean air to their communities? So with support from a philanthropy, we've been working to think about how to address capacity in these organizations to really think and thoughtfully invest in developing these hubs more holistically as resilience hubs. We've partnering with architecture and engineering professionals to actually conduct site audits with an eye towards resilience, actually costing out and thinking about how to connect those opportunities for resilience to capital investment for solutions. And at the same time have been jointly providing ongoing education and engagement with community partners and those who are using and in these facilities, both from youth through to elders, to think about how do we actually use this as an opportunity to have conversations about our own individual preparedness and the community's preparedness for these current and emerging risks. Next slide. As a direct response, we've actually been specifically building, starting with this indoor air quality challenge. And we've been doing Corsi Rosenthal box building and education events. So this is actually air purification. We've been providing these and building them with youth, building them with community members, doing air filtration building events alongside vaccine clinics and getting information out to community members around other health impacts and interventions and opportunities and services across the state and region. Across the Minneapolis region. So we've been targeting those communities that are disproportionately exposed, but then also carrying this out across the state of Minnesota. So really thinking about how to work hand in hand and improve life at the same time that we're talking about how we prepare for this emerging and changing future. Next slide, please. In addition to our air quality interventions, which is very tangible, we actually have air quality monitors. We've been measuring the improvements in air quality, and it's a great conversation, community science opportunity. But we also don't want to lose our individual touch points with people to pass us by. And so we've been building whole card decks of disaster preparedness resources that we partner strategically with understanding about current and emerging climate risks. And have been bringing these across the state. We've also been distributing these at the state fair. We gave out over 1,000 magnets to help people understand what it is you actually do when the AQI is high. What does it actually mean if it's red or purple? Do you go to soccer practice? How do you protect yourself? How do you protect your children? How do you protect your loved ones? So really thinking about these touch points as strategic opportunities to engage. Next slide, please. And in part, we in addition to sort of this quick overview of the many things that we're doing in all these spaces here, focusing really on some of those ways that we're trying to connect around health and well-being, is that I think we'd be remiss not to sort of end by really acknowledging very explicitly that the sort of research landscape is shifting both in health and climate and other domains. Our response and our service landscape have changed. And so at the same time that we're trying to do this work, we're also trying to figure out how do we do it in a durable way? How do we partner in new and clever ways as we think about and better understand the real ripple effects of the loss of support, the critical loss of human infrastructure, reductions in the investments that often help connect science to solutions coming predominantly from federal funding opportunities for energy resilience, for actual, sort of all different types of resilience and adaptation on the landscape. And increasingly figuring out how to navigate a shift in emphasis from the federal level to states to take on more responsibility for the response and recovery to weather and climate related disasters. So that is something that all states are starting to navigate. We're figuring out how are we part of that solution, while thinking about how we actually navigate and fill to the best of our abilities. Sometimes it feels like duct tape and gum, but those resources that underpin healthy and resilient communities. And as a way to sort of round this out, I think for me, as I've been reflecting on this and thinking about how it shifts or enhances some of the work that we do, just a real increasing imperative that we plan and that we're planful, that we partner, that we engage in movement generosity, that we seek to prepare and also innovate as we accelerate to do all of this work together and in a different environment. But I am so thrilled to be here and with the folks on this call and have benefited from your work, and hope that others on this call, we can link arms and partner and learn from one another as we move to ensure that everyone in our communities has access to a healthy life and solid healthcare. So thank you. I will now stop and pass it back.
Thank you so much, Heidi, and thank all of you for your informative and engaging presentations. Now we're going to move on to a question and answer session. And I see here we have a question in the Q&A from Sarah Shear, and it looks like that question is for Heidi. How did the University of Minnesota's Climate Adaptation Center form and obtain funding within the university?
Yeah, that's a great question. For our advisory board, one of my board members referred to us for a while as the ragtag group of do-gooders. Teddy Potter, who's here on the call, is actually one of our advisory board members. And it's been, I think, a creative approach. I don't know what really the method here is, other than I think casting a net and really trying to listen and innovate in how we were working. And so some of our early investment came from some agricultural commodity group organizations, alongside some dedicated research investments, both from the federal and the state governments, that enabled us to sort of do some early proof of concept. And then we actually spent quite a bit of time building bipartisan support from our state legislature, that really unlocked the foundational resources that we then leverage to return investment to the state through other funding, whether that's philanthropic, corporate funding, federal funding, or other state research dollars. So we've really put together sort of a diverse support system, but have benefited from really being on the landscape and demonstrating value in all the sectors that I mentioned, and making sure we have partners who we're working with, but who see real tangible benefits from our work. So a little bit of good luck, but also a lot of really just, I think, partner-centered engagement and support, and articulating a very clear public value had been part of it. But happy to share more as folks would like, or if you want to have, Sarah, if you'd like to have a one-on-one, I'm very happy to chat with you. We've got lots of states looking to see how their contexts might work to catalyze something similar.
Thank you. And I think this covers Laura's question as well, or this answer covers that. And then Beth had asked about the resilience hubs. Do you have a list of the Minnesota resilience hubs? Maybe that's something we can share out. with our resources
Yeah,
later?
that's a good question. I don't know if I have a very comprehensive list, but I could point you to some that have gained a lot of the press attention. And we also have a community of practice formed around that knowledge exchange between folks who have resilience hubs or are thinking about expanding components of their facilities or their community organizations to be resilient hubs. So yeah, happy to share that with you.
Thank you. I have a question for Ian. With your work that you've done at Rush, how have clinicians been most helpful in moving that forward?
That's an awesome question. I think one of the biggest things that clinicians have done to support this work, pretty much across the boards, is just be vocal advocates, right? Without their voices, it's just a bunch of sustainability nerds buzzing around like a gnat, and people get kind of frustrated with that. And to be quite honest, I'm not an expert. I'm not a surgeon. I'm not a nurse. I don't have the kind of expertise that those folks do. And it not only is inappropriate for me to tell them what to do or to make suggestions, but when it comes from them, from passionate advocates, we have a pediatric surgeon, Dr. Ami Shah, who is one of our most vocal advocates, and it's so incredibly powerful when she speaks because people listen, right? And I just think speaking up, being passionate, if you need help or resources and you don't feel like you're an expert, guess what? None of us are ever really experts in this space. We're learning every single day. But if there are resources that people like myself can hand over to support you in your education and understanding of these things so that you can be even more of an empowered advocate, let us know. I'm guaranteeing you anybody on this call would send you any resource that they've got their hands on.
Thank you. My next question is for Joe. I know there are a lot of clinicians looking to improve their skills and how to communicate climate action better. Can you share any resources that can help them get better at this?
Yeah, absolutely. There are many. I think the Yale program on climate communications is a fantastic resource. I would also direct folks towards the climate communication maps from Yale Climate Communications. You can actually go in and filter out to better understand the perspectives of your own community or region. And that way you're able to better align your communications with the values of your community. And that's what really needs to be at the heart of the communication, is connecting with your audience's values.
Great, thank you. Katie, with your work that you've done in your state, can you offer any advice about how to effectively engage with community members or indigenous populations?
Well, I would have to say, in general, the idea that nobody can do it all, and we all need to have, like take our little piece of the puzzle and then connect with other groups that have the expertise in their area, right? So no organization, our organization is filled with health professionals that have expertise in health, right? And we are not necessarily experts in environmental issues or in policy, right? And therefore we have to reach out to those folks that do know the intricacies of their community, right? In order for us to effectively use our voice to lift up their voice, to do other pieces. So I think in general, just having the lens of knowing that we can only do our little part and that we've got to connect with the others that have expertise in their specific area.
Thank you. Does anyone else want to add to that? I know many of you are working with communities.
I guess I can just chime in to say we always try to bring in local advocates. And so in developing this toolkit of resources for local advocates, I met with, a number of community-based organizations to get their input and perspective. What would be helpful? What would not be helpful to focus on in this kind of a resource? So always trying to bring folks in and be inclusive is really important.
Helena, is that a toolkit that is shareable in any way for others who
Yeah,
are
I'm
trying to
still
do
working
that
on
work?
it. It's not ready yet.
Okay.
But when it is done, it will be out there in the world and I will absolutely share it.
Great, thank you. And I saw that you had answered Rod's questions in the chat. Thank you for that. Definitely hearing more about data centers and their use of resources and how they have been many times driving up the cost of utilities can be very concerning. But Rod also mentioned that, you know, how EJ principles may at times be abandoned when it's time to move this work forward with them. And I know that you had answered in there, and I was just wondering if there was anything else you'd like to add along the lines of how communities can really speak up and protect themselves against this forward movement.
Yeah, it's a great question. And as you saw at the beginning with that map of where data centers are locating, they are kind of locating around these metropolitan areas where you have these EJ principles to consider. And so that's really something, in terms of the local solutions, I touched on sort of why those are challenging to address this problem. But one of the things we do mention in the report, and I have more on this in there, is about community benefit agreements, utilizing those to the extent possible early on in the negotiation stage, both for securing some kind of water resources benefit, but they can also be used to bring back some kind of other environmental benefit back to the community. And the example that I found, they're often used in transportation projects, was from 2011 in the construction of the LA airport. They were able to secure some things like electrification of gates and reducing idling at those gates as a benefit back to the community to reduce air pollution. So there are ways like that to secure something like that in the negotiation of these projects that communities could be seeking to do at that level. But yeah, negotiating for some of those things are probably challenging in this really high, fast pace. And I can't emphasize that enough, how fast this development is really going in bringing these facilities online.
Thanks, Teddy. Do you have a question?
This is a little bit different topic, and it's a resource that's available to all people. It was just released in September by the National Academy of Medicine, and that is a climate and health resource or information gateway. What we wanted to do is we gathered a group of people and we said the National Academy of Medicine wants to inform health professionals and citizens about the health impacts of climate change and what they can do. And as we sat around the circle, and everybody set put in their most favorite go-to resources, we realized that none of us, or many of us, didn't know what the resources were that our colleagues were mentioning. So we didn't need more resources. We just needed to find the resources that are out there and are really good and available to communities. So we decided to create a resource hub where somebody can log, get into it. They can say, I'm a parent and I'm concerned about my children and air quality. And up comes all the information for them, uh, uh, easily accessible. There isn't a paywall or anything like that, and it's all been vetted by the National Academy. So it's accurate information. It's not misinformation or disinformation, and it's preserved for your use. Or you might say, I'm a K-12 teacher and I want to present information in a classroom, or I'm a health professional. I want to share it with people in my that I care for. So you can get very tailored resources available to you. And Justin and Emma will share that link with you.
Thank you for sharing that, Teddy. Do you happen to know, or if anyone here knows, are the resources that many of you have mentioned in your presentations included in that gateway?
That's a great question, and they will be.
All
We're
right.
collecting all these resources, and as resources are added, if somebody says, I'm a psychologist and I use this to deal with the mental health impacts of climate change, we will be looking at that resource. We need to make sure that it's free and accessible to people, that it's accurate, and that it really is nonpartisan. We don't want it pushing any political messaging. Those are our three standards for the resources. But yes, it's a living hub, and we plan to continue to add emerging resources as they're developed.
Thank you. I have a question here from Juan. After appreciating these excellent public and academic initiatives, how can we articulate and combine them so that we can replicate them in other regions? I know that the Climate and Health Information Gateway is going to be one of those ways to combine. Are there any other answers to this that anyone would like to chime in on? Or even advice on replicating what you did?
I mean, I'd say no two story is going to be the same, right? So you can replicate based on general frameworks, but just know that like the story isn't going to necessarily turn out exactly the same for your organization and for your work. And tell it accordingly, right? It's going to be different for everybody. Your impact is going to be different. Your focus is going to be slightly different. So it's kind of a little bit of a non-answer, but I think it's your story to tell.
That's great.
And I'll just direct you to the other regional websites. The other programs are very worth listening to because we share these problems. Yes, we might not be the desert Southwest, but we're having heat issues in the Midwest. We might be having water issues, but other places, such as along the Mississippi River or in Florida or the Southeast, are also having water issues. So by going on there, you also have a chance to collaborate. You hear the recordings, you listen to the names. We're really about these starting to build capacity, and that's one of the sort of the next phases of this project is that we take all the people that were involved and say, how can we start to really keep engaged and keep moving ahead?
And study. There's so much good work going on, and it's so important, as many of the speakers mentioned, to not be in silos and to collaborate and not recreate things that are already happening, just really work together. One last question from Mike for Katie. Please share more about your education outreach to healthcare providers. Who tends to be the majority audience? And what is the frequency of workshops?
Yeah, it really depends, right? So I would say that in general, our members are made up of the gamut, runs the gamut of healthcare professionals, from physicians to allied health professionals, nurses, pharmacists, therapists, all of the above. When Healthy Climate Wisconsin puts on educational content, we will often do it for a webinar for a large audience, for a general healthcare professional audience. We also then do that annual conference, which again can be applicable depending on the session that you're attending, to to a clinical audience, to a community-based audience. It just kind of depends. And then we also have a speakers bureau, right, which will allow other organizations potentially to call us up and say, hey, do you have somebody that can speak to X audience on this particular topic? And so I think those are a couple of ways that we do educational outreach, in addition to when we're involved with our working teams, then we're having generally informal sharing of new content and new papers and literature out there as well between folks in the organization. And I unfortunately cannot answer what percentage of membership participates in these educational offerings. That would have to be something I take back to the team for.
Thanks.
Of course.
I think we have a minute for this last question as well. It's a good one. Under these initiatives, and I think this is one for Helena, what are your thoughts on incorporating AI to generate efficient responses and information for decision making? I guess kind of what are weighing the pros and cons of AI, knowing what we know?
Yeah, that's a tough one. We have not gotten involved in that level of the debate at the Alliance. We're really focused on the water quantity impacts. I think, everyone thinks that because we have the Great Lakes, we have this vast, abundant resource that we should just tap it. But really, the Great Lakes are finite. Less than 1% of the Great Lakes are replenished each year. But this is one of the angles and perspectives that we do need to be considering. How do we responsibly use AI? Are there best practices? Are there sustainable practices that can be used? It's just not something that the Alliance is working on at this time, but I'm sure there are other organizations that are interested in working on that aspect of it, and engaging businesses in what are those best practices for utilizing AI. On the other side of it, with water and energy standards that I talked about, conservation and efficiency standards for this industry, we don't even have those right now because of the lack of transparency. We can't even compare and contrast what are the best cooling methods, what's the most efficient practice there. So I think we need to start kind of from that angle, but then also, be considering these kinds of questions at the same time.
Great. Looks like we have a little more time. So Linda, how are local food producers being brought into these wonderful projects? Ian, do you want to take this one?
Sorry, I was raising my hand for another question that I had
Oh.
bubbling in my head. Could you repeat that question?
Oh, sure. How are local food producers being brought into these wonderful projects?
Great question. For us at Rush, local procurement has been a part of our anchor mission work for quite some time. And that was typically focused on other vendors and producers, but has recently really started spreading to local food vendors. and local opportunities to collaborate in that space. You know, from a sustainability perspective, it's an awesome win because, of course, you're shortening your supply chain, which leads to more resilience and a wide variety of other positives. But it's also a really great investment in the community from an anchor perspective. So we've focused on identifying local opportunities. A big one that I'd love to point out is we just transitioned over to Cahokia rice, which is a rice grown in the state of Illinois and actually has a higher protein content, which is better for patient healing. Win, win, win. It's a really cool example of just some really neat things that can happen when you're open to those local vendors and actively seeking them out.
That's great. Is that white rice?
White and brown, and farmer, oh my gosh, I think it was Farmer Bob, if I remember right, or something like that. He's the best. He actually comes and sells he was at the Wicker Park Farmers Market a couple months ago. No, it just went indoors for the winter, but amazing company, delicious rice.
Is anyone else working with local food vendors that'd like to share?
This is Heidi. It's sort of it's less about vending and more about engaging with our broadly across the agricultural sector. So as a program, we work with commodity crops through to specialty crops and smaller local producers. And so are part of a program that helps develop resilience planning for predominantly specialty crop and smaller farm operations. Some of that comes into thinking about how are we actually purveying food locally. And so we do partner with some other amazing organizations like the Good Acre, which is a food distribution hub that ensures that local food gets into school meals and sort of reduces that middle person broker and make sure there's a market for some of our amazing locally produced products. And so we do think holistically about how to partner, but also ensuring that we're providing resources, research, and sort of planning and implementation support to ensure we have a robust and thriving agricultural food system. And then we do work in specialty, we work with tribal food systems resilience as well. So all the way down to smaller gardens and sort of experimentation for ensuring that there's the ability to produce critical and culturally important foods and lifeways. So we sort of expanded that question a little bit, but we do have that as a specific part of our program and partnership.
Heidi, I'm not sure it's ready for, excuse me, prime time yet, but I think the work that's being done with the built environment with the architect firm is really also very exciting.
Oh yes, thanks, Teddy. I feel like Teddy, you're like my hype lady. I need Teddy on the payroll. Yeah, so one of the other things we're working on right now is just simple checklists for folks in all different types of housing environments to start thinking about, to begin to think about or advance their thinking around what makes for a resilient environment, whether that's your home or your yard or the landscapes around you, and just some simple overviews and checklist items just both help kind of connect people to understand sort of what they're experiencing, what they may experience, and then what those really critical near-term and long-term actions are, but in a digestible sort of checklist fashion. So those are coming out soon. They're in their final review.
Thank you so much. Thank you to all of you for joining us today and for sharing your wisdom and expertise. And thank you to all of our listeners for being with us today. We will have all of the slides as well as recordings and resources on our event page. So if you missed anything, you can always go there and access that. And we are going to be putting up a QR code. So we ask that you please fill this out and give us feedback. Thank you so much.